This is Debbie, and if you've ever had a physical therapist appointment, you need to know more about physical therapy. Maybe you're wanting to know what physical therapy does. I have asked Leon Bradway to be with us. Welcome to the show.
Thank you. Thank you.
Sports Back and Pain Management Clinic. That is what you operate.
Yes, I'm the owner of the Sports Back and Pain Management Clinic here in Bryan, Texas, off of Villa Maria Avenue.
And what type of people do you treat? What kind of problems do you treat?
The majority of what I see is patients with chronic pain. So a lot of patients with headache problems, neck pain, back pain. I also treat status post-rehabilitation, such as stroke, total joints, patients that have had problems with diabetes, that have an amputation, things like that.
Okay.
So
Are patients usually referred into your business?
patients are referred to my business, yes.
Okay. And what type of primary, is it a primary care physician or who usually refers them?
No, I see a variety of the referrals from internal medicine doctors, orthopedic surgeons, primary care, family medicine practice, pediatrics. No, I get a good variety of patient care.
Okay. Now, do people come to you how many times a week or?
Generally, depending on the severity of their problem, I'll usually see them twice a week for about 4 to 6 weeks, depending on how bad their problem is. And those that have more complications, I'll see maybe 3 times a week for a little while, and then break it down once they start to show progress down to 2 times a week.
Okay. Now, do you do all types of physical therapy?
Well, I consider myself a manual physical therapist.
Now, what does that mean?
And what that means is that I do a lot of hands-on mobilizing and manipulating the soft tissue and joints of the human body. I feel that by doing so, I get a better idea of what the patient's doing, how well I'm doing with their treatment progress. And so it gives me a lot of good information, and I can help either increase their therapy plan of care or not be so aggressive. So
Okay.
I do a lot of pain management through a lot of education, as well as a lot of discussing with the patient on what their problem is, and then how we need to get to what their goal is, because that's important.
Sure. Today you came to talk to us about fibromyalgia.
Myalgia, yes.
That's hard for me to say for some reason. Tell me, what is that?
Well, fibromyalgia came about in the early 1980s. Basically, what it is it's an acute type of diagnosis for pain within joints of the body, the spine, the low back, the neck area, even the legs at times can be involved. And those areas that are hurt someone, usually with pressure or touching, creates a lot of discomfort for them.
Now, is this something that happens all at once or is it gradual over time?
No, usually it's gradually over time. A lot of it through research today comes about through stress. Okay.
Okay.
Either or some type of traumatic incident in someone's life. And so what generally happens with someone with fibromyalgia is they just start to decrease in a lot of activity, whether it's physical, whether it's socialization.
They just hurt all the time?
They hurt all the time, right. And they have a lot of difficulty sleeping. And so this cycle just continues to keep this pain cycle going for them.
I've doing all the interviews for this show, I have learned that a lot of the things that happen to us can be prevented if we just, our body's talking to us and it's telling us what hurts. And sometimes we just take medications to mask the pain and not address it. Is that part of what this treatment is about?
Yes. A lot of, probably the problem with, one of the problems with fibromyalgia is that sometimes it can be very hard to diagnose. So for someone that comes in to see their primary care physician or their family practitioner. And so a lot of times fibromyalgia doesn't get diagnosed for someone until 3, 4, 6 months down the line, until they've just, they can't get any relief. And so X-rays, MRIs don't see anything. So generally the diagnosis of fibromyalgia will be placed upon that individual.
How can we treat this symptom, and really this is going to create a trauma in our entire lives. It's going to upset just living, isn't it?
Right, right. It does. It makes it very difficult for someone who, like I said, has a lot going on in their life, has maybe some things that have happened, and they have to try to deal with this pain that they're having and work and tend to whatever they need to at home. At the Sports Back and Pain Management Clinic here, what I try and do with my patients is I categorize into 4 areas. One is the body, the mind, the spirit, and then also posture.
Okay.
Okay, or excuse me, purpose. The body part of it is getting a good evaluation from the patient, making sure that you cover the systems that are bothering them, such as the back, the neck, or even the lower legs, so that you get a good evaluation of what's going on, what they're doing in their life.
And how do you evaluate people?
I evaluate them like any medical doctor would. I have them fill out paperwork. I get an idea of what their day-to-day routine is, what things that they're doing or not doing, and then I go through a physical examination of what range of motion, what strength problems they may have, and what areas are affecting giving them pain.
Now you talk about their mind.
Right.
How does that play a part in it?
Well, the biggest part about that is having a good attitude. That the team approach is the best with fibromyalgia, and the reason why is because you need to have the doctor that's prescribing the medication, whether it's a doctor or a psychologist or psychiatrist or your primary care physician. And then you've got to have, the other aspect of it is you've got to have some type of physical activity within the scope of plan of care.
Okay.
And so by getting someone involved with a team approach, and then that team has their own guidelines of how they want to progress you, is very helpful.
Okay. I guess people's mind really does play an important part of their recovery and of what's going on in their lives and how they handle stress.
Right.
Everybody's different.
Very much. Very, very different. And that's one of the things that I try to help with, along with the team approach, is finding out things that really gives this individual a lot of stress, and then how we can change. And I say we because it's a lot of them helping me to help them get better, and
Sure.
that's important.
Spirit, that goes, I guess, with the mind as well.
Well, it does. The biggest thing about the spirit of it is ensuring that the patient feels comfortable with you. The patient feels that there's a trust there that you're going to help them get better. And so by doing so, and letting them know what their problem is, kind of what the course of the plan of care is going to be,
Sure.
They feel comfortable, and so that gives them a little bit of a boost that, okay, maybe I can start to get rid of some of this or get through some of this a little bit better.
And you help them set goals, and goals are important in all aspects.
Absolutely. Goals are very important with any type of chronic pain problem. Goals are essential, and that's one of the things that I try to press upon my patient is I can give you all of the information that I see and find, but you have to have goals. There has to be something that we need to work toward, whether it's being able to get out and walk a couple days a week, or achieving some type of exercise routine, less pain or something, so that we can show that there's progress, and it also gives the patient some purpose that they feel that they're making progress themselves.
In the information you brought me this morning, it said this fibromyalgia affects 5.8 million Americans. So there are people around us that have this that may not even know what they have.
That's correct. Yes.
The female to male ratio is people is 9-1. So this is a female type issue.
Yes, very much.
Why women? Why is it affecting our systems more?
Well, it could be. There's several things. One thing is it could be hormonal, okay, because of either the changes in our hormone system, and it's been proven in research that with different levels of hormone or more in the body, it can create swelling and inflammation.
And that would make us hurt.
Right, that could make you hurt, exactly.
All right. You said short bouts of exercise each day can help people feel better and function more effectively. And I think exercise is kind of the underlying thing is take care of yourself, eat right, get plenty of rest, drink water, and exercise makes everything better, including this.
Yes. Yeah, it's a start. And as long as someone knows that they can have a starting point, and then depending on how severe their problem is going slow with them so that they trust that you're going to take care of them.
Okay, if people are feeling that this could be them, how do they get in touch with you, Leon?
Well, like I said, I'm located in Bryan, Texas, off of Villa Maria Avenue. You can give me a call. My phone number is 776-2225. I will, if you've got some type of problem or you're curious about something that your doctor is having you do, or you're not getting enough physical activity, I'd be more than happy to speak with you and give you some of my my ideas.
Great. Now, if people want to come by to set an appointment, is that possible too?
Yes.
Okay.
Yeah, you can come and see me in the state of Texas. And a physical therapist can evaluate anybody.
Okay.
They do not need a doctor's referral to evaluate someone with a problem. And what I generally do, and what's worked out here in the Bryan College Station area, is that if I see you without a referral, generally what I'll do at that point is call and speak with the doctor and let them know what's going on, and then ask for a referral for whatever problem that you may have.
Got it. So it really is a team approach.
Yes. Very much.
Your number again is 776-2225.
That's correct.
You see patients all week long?
All week long. 8 o'clock until 5:30 every day.
All right. Well, I thank you for taking time with us today.
Well, thank you. Thank you very much.